Hello to everyone online today. Welcome to the final webinar of the 2019 series. We hope you've enjoyed our offerings this past year, so please keep an eye on our website for our upcoming 2020 webinar series schedule. I'm Nellie Gontier, Education and Training Specialist for Parkinsons Canada. We are very fortunate today to have with us Dr. Susan Fox, who will be discussing the medical cannabis topic, dispelling myths, and looking at some truths. Dr. Fox has been a neurologist at University Health Network since 2003 and is the director of the Division of Neurology, UHN, and associate director of the Movement Disorders Clinic, Toronto Western Hospital. She's also a professor in neurology at the University of Toronto. She did her medical and neurological training in the United Kingdom and received her PhD from the University of Manchester, England. Dr. Fox has led various leadership roles, including Secretary of the International Parkinson and Movement Disorders Society from 2017 to 2019, Chair-elect of the Pan-American section of the MDS 2019 to 21, Chair of the MDS Evidence-Based Medicine Committee 2013 to 2018, and Fellowship Director of the University of Toronto Division of Neurology from 2004 to 2013. She has served on many grant review committees, journal editorial boards, and advisory boards, and has been chair of the Medical Advisory Committee for Parkinsons Canada since 2015. She has over 20 years' experience in preclinical models of Parkinson's disease and translational studies of novel pharmacological therapies for Parkinson's disease and other movement disorders, such as dystonia. She has published over 160 peer-reviewed papers, reviews, and book chapters in the field and is a regular speaker at national and international conferences. And with that, please join me in welcoming our guest, Dr. Susan Fox.
Thank you very much for the very kind introduction.
You're welcome. Welcome.
Thank you. So what I'm going to do is talk to you all today about cannabis in Parkinson's disease, myths and facts. This is probably one of the commonest questions that I get asked about in my clinics today. So hopefully at the end of this talk and with your questions and some answers, we can perhaps dispel some of the myths and give you some of the facts. So with any talk, I have to acknowledge disclosures, and I'd like to acknowledge particularly Dr. Freitas, who was a fellow with me and is now working in Hamilton, for assistance with some of these slides and her help in some of these studies. So what I'm going to do today is give you an overview of the possible role of cannabinoids in Parkinson's disease, look at some of the evidence that has been published on some of the symptoms of Parkinson's that may be controlled by cannabis. So this is the motor symptoms as well as some of the non-motor symptoms. So what is cannabis? Well, for most people it's the plant, and this is Cannabis sativa, and this has been traditionally used for millennia for medicinal purposes, particularly for pain control and epileptic seizures. And due to the recent legalization in Canada of personal use of cannabis, there's certainly been more interest amongst everybody as to whether this should be used or can be used and is safe to use for a number of medical purposes. The challenge that we face as clinicians, and obviously then in terms of you as people who may be interested in using it, is that there is limited evidence from randomized clinical trials that many of these products are safe to use and the benefit. And so this leads to many myths around the use of cannabis. Interestingly, cannabis is a plant, but within our brains, we also have cannabis products, if you like. So it's a very complex pharmacology. So what I've got on the next two slides is to talk about the pharmacology of what we call exogenous cannabis. So this is the plant and other products. And then there's the endogenous, or the internal cannabis system that we actually have in our brains. So to start with, the exogenous cannabinoid pharmacology is complex. The plant itself contains over 100 pharmacologically active compounds. The ones that most people have heard of are listed here. So delta 9 tetrahydrocannabinol, or for short THC, is the one that gives people the high. And this is why people originally started to use some of these cannabis products. One of the other more common types that people have also heard of is CBD or cannabidiol, and this is thought to have less of this psychoactive property, and so may be more helpful for use in medical conditions. Cannabis plant itself, the sativa has a very high THC concentration, and so this is why people have used this for the high properties that it gives. And certain strains have different properties and percentages of THC versus cannabidiol. And this is one of the challenges that people have had when they've used the plant, in that there are various combinations of the active versus the psychoactive components, and this can lead to challenges in knowing how beneficial and how safe these compounds can be in clinical studies. So herbal cannabis formulations are available in Canada, and as we know, the smoked and vaporized cannabis has now been legalized for personal use. There are also cannabis oil preparations available that have varying combinations of THC, CBD, or combinations of both. Some people might be interested to know that there are actually medications that contain cannabinoid or cannabis products that have been licensed over many years for certain medicinal purposes, and these are the ones listed here. So Nabilone contains CBD and has been approved for severe nausea associated with chemotherapy. Dronabinol contains predominantly THC, and this is also used for nausea and anorexia, weight loss, again associated with chemotherapy and also HIV. And then the third one is this spray, which contains a type of cannabinoid called nabiximol, which has THC and CBD in it. And this has been approved for therapy in people with multiple sclerosis who have spasticity and pain. So there are some cannabis products out there that have been available on the market for many, many years. This is a useful website for it says for healthcare professionals, but really anybody who is interested in learning more about cannabis and cannabinoids. So this is a reference that certainly I would direct you to get more information about cannabis, because I won't be able to give you all of that in today's webinar. So as I mentioned earlier, there are endogenous cannabinoids. We have them in our brains. We have receptors, a cannabis receptor type 1 or CB1. There is a cannabis receptor type 2 or CB2. And then there are other types of cannabis receptors that I've listed here, VR1, TRPV1, which also may mediate some of the actions of cannabis. So cannabis that we have in our body, in our brain, are called endocannabinoids or endogenous cannabinoids, meaning that they're inside the brain and inside the body. And the two most common ones that have been described are anandamide and this other one with a very long chemical name, which is shortened to 2-AG. This slide here just summarizes the complex pharmacology. So you can see on the left, you have the endocannabinoids, and on the right, you have the exocannabinoids and the synthetic ones that I just mentioned to you, nabilone, dronabinol, etc. So continuing to give you a little bit of insight into the endogenous cannabinoid system, these are complex chemicals. They're what we call phospholipids, which means they're present within the cell membranes, and they're synthesized when an action potential activates the cell membrane, and so they're what we call synthesized on demand from cell membranes. And these pictures just give you some idea of the complexity of these phospholipids. So what is the normal function of cannabis in the brain, in the body? Why do we have endogenous cannabinoids? Well, the research to date has really suggested a number of possible functions, and I've listed these here. So these may be released when people have some sort of injury, and so there may be a natural pain control from these compounds. They also seem to mediate the amount of food that we take in, so this is why they have been used in people who are not have a poor appetite or are anorexic secondary to chemotherapy. They may also have a natural anti-nausea effect. They seem to be important in how we control our temperature. They're also important in learning and cognition. And this is a very important aspect of their potential function, because this is obviously a possible long-term side effect of use of exogenous cannabis or cannabis sativa, particularly in young people. Interestingly, and this is where the interesting in Parkinson's comes from, is that the cannabis system may also be involved in the way that we move and in terms of motor coordination. And I'll tell you a little bit more about that. So I've been interested in the role of cannabis in the brain for many, many years. And this is some work on the left with these pictures that I did when I was working in Manchester when I was doing my PhD. And we looked to see where in the brain cannabis receptors are located. And as you can see on these pictures, the red area, it shows high areas of cannabis receptors. And these are, interestingly, in the area of the brain called the basal ganglia, which is the area of the brain that's important in Parkinson's disease. The picture on the right shows a scan of a person with a normal person, and they've measured the amount of cannabis using a special ligand that can bind to cannabis receptors, and this just shows in more detail that the cannabis receptors are located preferentially within the basal ganglia, so may be implicated in movement control. We also did some work, again, when I was in Manchester, measuring cannabis levels, these endocannabinoids, within areas of the brain to see if there was a role in Parkinson's disease. These are studies that were done in the lab in models of Parkinson's, but what we did show was that in models of Parkinson's that there is an increase in these endogenous cannabinoids within certain areas of the brain. So showing that within the brain of a Parkinson patient, potentially, there are changes in endocannabinoids. And this has been done by other researchers subsequently confirming the same results. And this is a study from Italy where they looked at people with Parkinson's and looked at the cerebrospinal fluid doing a spinal tap or lumbar puncture, and did show and confirm that in people with Parkinson's there are higher levels of cannabinoids in the CSF, so suggesting again that there are changes in cannabinoids within the brain of people with Parkinson's disease. As I mentioned, one of the normal functions of cannabis in the brain via cannabis receptors may be in movement control. So how does that work? So the next 3 slides are just a very simple overview of what we believe is the way that the brain controls movement and what happens in people with Parkinson's disease. So this first slide is a cartoon showing how normal movement is controlled by the basal ganglia. So it shows circles that represent areas of the brain, and just simply there are circuits that come from the cortex. There are areas that come from the midbrain, the substantia nigra pars compacta, which is where the dopamine cells are located that are reduced in Parkinson's disease. The arrows just show the connections between these areas of the brain, and these connections are either excitatory or inhibitory, and the balance between these circuits is what drives normal movement. So in people with Parkinson's, where you've lost the dopamine input to these regions, then there are changes in these signals, and this leads to slowness, stiffness, and tremor. And what we do know is that because the cannabis receptors are located within this area of the brain, the globus pallidus, then this may potentially be an area where targeting that part of the brain with cannabis-like products could potentially help Parkinson's symptoms. Equally, some people who take levodopa for many years with their Parkinson's can develop this excessive movement called dyskinesia. And this is probably an area, again, where cannabis receptors are located and change in people with Parkinson's and dyskinesia. And again, this is an area that we have looked at particularly as a potential therapeutic target for cannabinoids for people with Parkinson's and dyskinesia. And this cartoon here just shows you where these cannabis receptors appear to be changing in the brains if you've had levodopa for many years and developed dyskinesia. So this slide again just summarizes what I've mentioned, and I will move on to the next one. and to show that there have been many studies that have looked at this potential. So can cannabis receptor stimulation reduce or treat levodopa-induced dyskinesia? And this has been looked at in many models of Parkinson's and suggests that maybe it could be a potential way of reducing dyskinesia. However, what we did was then go on to do this in a clinical trial, and we did this in a small number of people with Parkinson's disease who were having dyskinesia after taking levodopa. And we did show in this small group that there was a very mild effect, but it wasn't really significant. So it was a very minimal benefit on the dyskinesia. One of the other challenges that we noted was that some of these people did develop quite significant dizziness and drowsiness with this cannabis product that we were using. So this was a very small study which showed maybe a very small benefit, but obviously with some side effects. Another group has also done a trial using another cannabis preparation in a small number of Parkinson patients using this cannabis extract called Canadore, which was available in the UK a few years ago. They showed that the cannabis product was well tolerated, but it had no significant effect on the level of dyskinesia in these people. So again, suggesting that there may be less of an effect that we were hoping from the preclinical studies. And since that time, there have been a small number of studies looking at the effects of cannabis preparations in Parkinson patients, looking at the effects on dyskinesia, also on tremor and some of the other motor symptoms. As you can see from this slide, which just summarizes some of these studies, they've all been fairly small studies, but generally overall, none of them have shown a significant benefit. And indeed, some of them have also shown some quite significant side effects, drowsiness, dizziness. This second slide shows some of the case studies that have been reported. So these are a series of cases of people who've used cannabis products, a range of these products, either from smoking marijuana to using tablets of cannabis, CBD, for example. And as you can see, generally the overall effect on the motor symptoms of Parkinson's has been very minimal. Indeed, there was a review from the American Academy of Neurology published a few years ago where they reviewed all of the evidence that had been published in the field of Parkinson's and tremor with Parkinson's. So this is levodopa-induced dyskinesia and tremor for Parkinson's. And generally they suggested that overall the evidence so far really says that that cannabis products are probably ineffective for helping with these particular symptoms. They also mentioned that the risks and benefits have to be carefully weighed, and also the risk of side effects was quite significant. And so the overall take home really at the moment from this is that for the motor symptoms of Parkinson's, there's probably limited evidence for use of cannabis products of any type, whether it's the herbal, smoked, or the oral oils, or even some of the tablets. At the moment, there isn't really enough evidence to suggest that there is a benefit for the motor symptoms of Parkinson's. However, it's probably more that cannabinoids may help non-motor symptoms in Parkinson's. So this is really where the field and research is heading towards. So people with Parkinson's have significant issues, often with sleep. Some people can also get pain, and this can be associated with stiff muscles, tight muscles. It may be improved with levodopa, but sometimes it's not. And so for some people, this can be quite a significant problem. There have been some what we call anecdotal or case studies that have suggested benefit of cannabis products in some of these symptoms, but so far there haven't been any large randomized control trials to really prove the evidence, to prove whether this is a symptom that would benefit from cannabis products, and also to measure how safe or tolerable these products would be. So there is a lot of evidence for the use of cannabis for pain outside of Parkinson's. So people with pain from other reasons have used cannabis products, and there have been many studies both in the lab and also in clinical trials to show that cannabis products certainly can help chronic pain. And as I mentioned at the beginning of the webinar, there are medicinal pharmacological products, nabilone, dronabinol, and the Sativex that are actually licensed for use for pain. This slide just shows an overview summary of some of the clinical trials that have been used for pain. Again, this is not in the Parkinson field, it's pain in general. But overall, if you look here to the right side, you can see that there's a little diamond shape which is favouring the benefit of a cannabinoid over a placebo. So this is what's called a meta-analysis, and it suggests overall that cannabinoids may be helpful for pain in general. As I mentioned, there is Health Canada approval for this spray to treat pain. Again, not for Parkinson's specifically, but for other types of pain. So again, this is more evidence that cannabinoids in general may be useful for pain. There have been a couple of very small earlier studies looking at the use of cannabis products in Parkinson patients. The study here on this slide was using smoked cannabis, and this was in a small number of studies, and patients were smoking cannabis, and then they were assessed to determine if the smoking of the cannabis could improve their pain. The results section here, as you can see, it showed that this score was significantly decreased, suggesting that the smoking cannabis could improve the pain. However, obviously the inhalation of cannabis is not without risks, and there are medical concerns about smoking cannabis, and some of the side effects are listed here. Particularly for Parkinson patients, one of the concerns that we in general have with cannabis, particularly the smoked cannabis, is the risk of generating or inducing hallucinations. And so this is obviously something that we have to monitor if people are using this type of cannabis. But this suggested that possibly cannabis may help pain found in people with Parkinson's, but obviously smoking cannabis is not something that we would recommend or would be helpful long term. So as a result of that, we are undertaking a study looking at a safer preparation potentially of cannabis, which is the cannabinoid oil preparation. And what we're doing is the initial stages when we're evaluating a intervention for Parkinson's, which is always to do what we call an open label study. So here we're simply giving the cannabis oil to the patient. I'll tell you a little bit more about the method in a second, but this is just at this stage we're going to determine effective dose and which of the 3 types of preparation is the best tolerated. If this shows benefit with safety and tolerability, then the next stage of the trial would be to do the very formal randomized double-blind placebo-controlled trial in a larger number of patients, and that's called a phase 3 trial. So at the moment we're on what's called the phase 1 trial level. So this is just the initial stages of evaluating the benefit of this oil in Parkinson patients. So this is going to be a 2-site study, myself here at the Toronto Western Hospital, and in collaboration with my colleague, Dr. Mestre, who works at the Ottawa Hospital. We're going to be recruiting 15 Parkinson patients with bothersome pain, and they're going to be dosed with the oil once a day over a short period of time, 35 days. We're going to randomize these 15 patients into the 3 groups, and each group would be randomized to the 18:0 concentration, the 10:10 concentration, or the 1:20 concentrations of THC and CBD. And the aim really is to determine which of these different combinations is the most tolerable, the safest, and maybe gives benefit to enable us then to go on to the next stage of the trial. So this just shows a little bit more detail about how we're going to do the study, and it's a very standard study at this level of development. The D means the days, so this shows the days along the bottom. So we're going to go up to 35 days of dosing. So it's a relatively short duration trial, but over that period we'll get enough information to enable us to hopefully get details to go on to the next level. So as I mentioned, the objectives really to determine the tolerability and safety of these 3 formulations of cannabis oil for pain in Parkinson patients. So we're going to determine what's the maximum tolerated dose, and then look to determine clearly the safety and any adverse events that people may report. There are a number of other outcomes that we will measure. So we will look at any effects on people's motor symptoms. So this is in terms of tremor, stiffness, slowness, walking. We'll also look at sleepiness, because as I've mentioned, pain may help also with sleep. And we're going to measure some of the other aspects of pain. What people will we be recruiting? Well, these are people who have significant pain, and we have a specific pain scale that we measure pain. This is called the King's Parkinson's Disease Pain Scale. People have to be on stable medication, and because of the risks of cannabis and drowsiness, people would not be able to drive during the duration of the study. There are a number of challenges with any new trial for a product like cannabis, and it's probably even harder with this type of product because we really have no evidence or information as to what type of dosing people should be using. And this is just listing here on this slide some of the challenges in terms of trying to investigate the role of cannabis in Parkinson patients. We've asked people who have actually been using some of these oils what their dosing has been and what we find may be safe. And so the average dose we think may be safe is between 0.3 and 0.4 mils per day, but obviously this is anecdotal, and we'll be monitoring this as the trial goes on. Just a couple of slides to finish, and looking at some of the other non-motor symptoms for which cannabis may be useful. As I mentioned, sleep is a big issue for many people with Parkinson's. It can be difficulty sleeping at night, or it can be, in contrast, too much sleepiness during the day, excessive daytime sleepiness. So far, there haven't been any large randomized controlled trials investigating the benefit of cannabis for sleep. This is a very small series of 4 people who were reported to take CBD for 6 weeks, and looking at RBD is REM sleep behavior, which means very active dreams at night, which can be something some people with Parkinson's experience. And this study showed, perhaps with these doses of cannabidiol, that there may be a reduction in REM sleep behavior disorder, but this is again just anecdotal for people, and further studies certainly need to be done. What are the risks? And obviously this is always the challenge with using any product that's got cannabis-based pharmacology, and particularly for people with Parkinson's, because the blood pressure is low in many people with Parkinson's already, and adding in a compound that could lower that further could worsen this, and this is called orthostatic hypotension. This means that when you stand up, you feel dizzy or lightheaded, and this can be a challenge with any of these cannabis products. Other problems that have been described are excessive drowsiness, sleepiness. The other big issue, as I mentioned at the beginning, because we know cannabinoids may be implicated in learning and memory, is that with cannabis exposure, particularly long term, there may be cognitive problems. So worsening of any memory or cognitive impairment has been is a potential issue. People say cannabis is not addictive. However, there is certainly evidence that it can be. It's clearly not as addictive as opioids or other pharmacological agents of that sort of nature. However, there is some evidence that it can have some addictive and dependency issues. So obviously, again, for people using this long term, this is something to bear in mind. And then finally, And again, particularly with Parkinson's, we always have to be very careful of the risk of what we call psychosis. So this is hallucinations that can occur quite commonly in Parkinson's anyway. But with these cannabis products, particularly if they've got THC in them, then this is also something that could be triggered or worsened. And again, this is something that we always counsel people about, to be very cautious if they are going to use any cannabis product. So there are a list here of risks and adverse events that it's always important to bear in mind when considering using medical or personal use cannabis, particularly with Parkinson's disease. So I'm coming to the end now of my slides. And so as I've mentioned, there have been many studies looking previously at number of cannabis products, cannabis formulations. The problem that we face in the research community is that, particularly with the herbal formulations of cannabis, there really isn't a lot of regulation over the type of product, THC, CBD, within these products, and they vary according to the person, the dispenser, the distributor. And so it's always very word of caution about buying these products, that we really do not know what is in them sometimes, and they vary so much. So using them in a clinical trial is very challenging. This is why we're now using the oil, where we feel that maybe more regulation over the amount of the CBD to THC. The other challenge that has been noted is that the studies so far generally have been fairly small, and really we still lack large, well-designed, randomized, placebo-controlled studies to really give us that good evidence, confidence of evidence for or against the use of cannabinoids for any indication really in Parkinson's disease. As you've heard, cannabis is currently approved for management of chemotherapy-induced nausea, chronic pain and spasticity. So there is clearly a use for them in certain conditions. And again, just to emphasize, really the evidence at the moment does not really support the use of any cannabis product for the motor symptoms of Parkinson's or for levodopa-induced dyskinesia. However, preliminary studies are suggesting that possibly cannabinoids may help Parkinson patients with pain, and this is where we're hoping future use of cannabinoids may be beneficial in the Parkinson population. And so I'll finish there, and and then we'll move on to any questions. So thank you for your attention, and I look forward to having some questions.
Wow, thank you, Dr. Fox, for that very eye-opening and really current information. A lot of people have been asking for this type of session for quite some time, especially with the changes in legislation that just occurred just over a year ago. So what we're going to do, we're going to open the forum for questions, and while our audience is typing in their questions, let's maybe start with a few of our own. What are the barriers to larger studies, Dr. Fox?
Yes, so thank you for that question. That's actually a very timely question. At the moment, we're really struggling with the legislation changes has actually meant that Health Canada approval to do clinical studies using cannabis products have been put on hold for many, many months. And this really comes about because of the explosion in companies that are now wanting to market cannabis products for personal use, and obviously they want to improve their income and bottom line, and so they're applying to Health Canada for licenses, and this has meant that the research community has really been put to one side. However, there is light at the end of the tunnel, and from September, as of September, there have been more streamlined approaches for institutions and individual researchers to get licenses, and this is now starting, and we're at the moment just waiting for our license just to be finally approved, and I'm hoping we can really get started with our trial in the early new year. But it's very interesting how this is the change in the legislation for personal use has really knocked back the ability of researchers to do good clinical trials in cannabis. But I'm hoping now with this new streamlined approach that we can now actually start.
Okay, thank you very much. Are you aware of a particular study, I don't know if there are others, published in the Journal of the Alzheimer's Disease in 2016 that indicates that marijuana users actually have decreased blood flow to the cerebral cortex, especially the hippocampus, and that this, indicates damage to the brain, especially in the areas of memory and learning?
Right, yes. I'm not aware of that specific study, but certainly there is accumulating evidence that chronic or even acute cannabis use could potentially affect memory in people either with known memory issues, i.e. Alzheimer, but also in people without known memory issues. And this is a big concern in the community, that this is a potential long-term risk of cannabinoid ingestion. The other big area that's of concern is in teenagers and cannabis use in teenagers. There's a concern that long-term use may lead them to develop cognitive issues earlier in adult life. So the reduced blood flow is probably just one mechanism that could explain the reduced memory and cognitive issues that could occur with cannabis.
I see. Okay. Well, let's look at the dosage then. Where do you recommend someone go to determine the dosage that works best for them if your doctor will not comment due to being unfamiliar with CBD?
Yes, this is a question I get asked, and it's interesting hearing people's experiences. And I'm always very curious as to the people who are giving this advice in these wherever they're getting the advice from. They're clearly not medical, and where they get the information and why they're just giving people advice about certain doses. As I said, there really is no evidence. So I've always said, if you're really wanting to use and try, always go with the very lowest dose. And make sure there are people at home with you when you are taking it, just in case it makes you feel suddenly dizzy, unwell. But there really is no written advice or good medical or scientific advice as to the dosing, and this is one of the big challenges. So when people are given a dose that they've been said this is the dose they should take, people always need to be very cautious about it. And as I said, always go with the very low level to start with.
Okay, so we've got lots of questions coming in. A couple of them are related to your study, the study that you're doing with your colleagues. The questions are, have the participants of the study been chosen, and are all the studies going to be done with organic oils to ensure no unwanted reactions and only see the cannabis results?
So there are still spaces to take part in this study. If people are interested, then we can arrange for their they can send their contact details in. We can figure out the best way to do that. If they're patients in the clinic here, then that's straightforward. If they're outside patients, they would need to be seen and reviewed to ensure that they would meet eligibility criteria. The second part about the oil, yes, for this particular study, we're just simply using this single preparation of the oil with its 3 different combinations. We're not going to be using anything else at this point.
Okay, all right. There's a question also regarding, could you discuss the use of CBD in relation to nausea, and is it an acceptable treatment in MS and chemotherapy?
So yes, it's one of the actual Health Canada approved indications using there's dronabinol and nabilone are actually approved pharmacological drugs that are used for nausea, and so it certainly can help in those individuals. For Parkinson patients and nausea, it's never really been investigated as a treatment, and nausea is usually very transient in Parkinson's. When you start on levodopa, and it should usually go away very quickly. So I wouldn't have thought that would be an issue really with most Parkinson patients.
Okay. Another one. Based on preliminary findings, has research on cannabis as a treatment for tremors or dyskinesia slowed down, or is that area still being pursued?
So that's a good question. At the moment, from what I've told you there, with the particular cannabis products that we have available, I would say that avenue has probably slowed down or even stopped. However, there are other ways of targeting the cannabis system, and I didn't have time to go into all of that because it gets extremely complex with all the pharmacology. So there are new avenues being investigated that don't target the receptor itself, but might target products that are released, or sorry, some of the what we call downstream circuits and pathways that produce cannabis in the brain itself. And so these are potential targets for treating the motor symptoms of Parkinson's. And this is being investigated in a number of labs at the model, sort of the preclinical level. None have yet been taken or potentially ready for clinical trials, but it is another avenue that's being explored. So
Hmm.
yes, so there are
Yeah.
alternatives being investigated. Yes.
Excellent. Good to know. Another question, it's about the dose again. One of our viewers is asking, he has a mother who's 69 years old, has had diagnosed with Parkinson's 13 years now. The question is, how long does it take to start to feel the benefit if you are using oil?
Well, I guess we don't really know, and this is one of the reasons for trying to do more studies to find out these answers for people. You know, what's the best dose? How long do you treat for, etc. From people who have been using the oils and have come and reported to me in clinic, it usually takes a few days. It's not an immediate overnight. Um, the other caveat I would say that I've heard from a number of people is that they may be using the oils particularly at night to help them sleep. I would say that's probably one of the commonest reasons I've heard people use it. But what they're also reporting is that after a few weeks of using it, the benefit is wearing off. And
Hmm.
so this is why it may be better to use it intermittently. So, you know, not every night, but every 2 or 3 nights, so you don't lose that benefit. So this is what's called tolerance, that you build up a tolerance to the medication. So those are the sort of anecdotal reports that patients have told me in my clinic.
Okay. Well, you've actually answered the next question I was going to ask. One of our viewers was asking, because if you do take it for pain and it does cause drowsiness, then would it be best to take it before bed? I think you've sort of answered that. Um, on the note of tolerance, I mean, most medications and most people build up a tolerance to medications. What what is the anecdotal evidence on tolerance? How quickly does that occur?
Right, yes. And again, it's one of these questions there hasn't really been enough evidence in people with Parkinson's to know. In people without Parkinson's, certainly tolerance does develop to cannabis products, and people end up having to use higher doses to get the same benefit. So I think that is something that potentially could be an issue also in people with Parkinson's using cannabis products, that the dose has to go higher and higher to get the same effect on their sleep or their pain. Then the concern is that side effects could become more potentially more of a problem. So the worry then is of dizziness, lightheadedness, and also the psychosis possibility with hallucinations. So in general, yes, cannabis over time people do get tolerance to it.
Okay, and speaking of risks and benefits and all that, um, what do you think of using cannabis oil for stress or anxiety management, especially when you consider that stress typically heightens the PD-related symptoms?
Yes, that's a very good question, and I have been asked that question by people about particularly anxiety, which is a common symptom for people with Parkinson's, and having anxiety, yes, can make your tremor worse. Um, Again, there's no evidence that cannabis products can improve anxiety. It has been used in people with anxiety without Parkinson's and can potentially help relax the body, and so you have less anxiety. So anecdotally, again, people have been using it. The same advice as I've given before about, people that are using it for sleep. It's a very, very low dose and to be very cautious. But the effect of cannabis is generally on as a relax. It can have a general relaxing effect on the body, and so it can reduce some anxiety symptoms. Now, whether anxiety in Parkinson's is exactly the same as anxiety without Parkinson's, this is obviously something we don't really know enough about to know whether cannabis really is has a good benefit for people with Parkinson's and anxiety. So this is another area that really needs further research and exploring for sure.
Mm-hmm. What about the route of administration or the formulation,
Formulation,
oil?
yeah.
Yeah.
This is another big challenge with doing research in cannabis, but also then equally for people who want advice about how to use it. Um, the big challenge is, as I mentioned, that the amounts of THC, CBD that are written on a label in a package that people are buying is not always what's actually in the package, and there's a lot of concern that people are buying things that actually aren't what it says on the label. So the formulations you have to be very careful of, particularly the herbal products. The oils are perhaps a little bit more regulated, but still the combinations aren't always completely accurate that are written on there. The only ones that there are sort of is a guarantee that you're getting what it says is obviously the pharmacologically Health Canada approved Nabilone, Dronabinol, and the Sativex spray. Anything else, it varies company to company.
Is that because we don't have the infrastructure in place to regulate this?
Well, it's because they're not Health Canada approved. I mean, they're allowing people to have these compounds for personal use, but Health Canada aren't actually then regulating the amount that companies are producing and selling to people. That's the challenge.
And quality control's an aspect
Quality
of that.
control, correct? Yes,
Yeah.
yeah.
Yeah. Okay. So having said all that, are we barking up the right tree?
Well, that's it's a good question. It's the whole issue of using cannabis is it's sort of switched in Parkinson's, for example, it's sort of switched around from the sort of the usual way that we look at things, because normally we've come up with an idea of a particular target or new drug, and then we do the normal testing in the lab, and then we go into patients, and then we do the big clinical trials. With cannabis, it's already out there. People are using it. So we're sort of taking steps back and we're going backwards. And it's a very different strategy to how we've always done clinical research before. So we're sort of having to sort of rethink how we do it. I think overall, I do believe that there is some role for exogenous cannabis preparations for some symptoms in Parkinson's. So I'm not saying we shouldn't use it at all. There has to be a very clear understanding of the safety and tolerability of cannabis in Parkinson's. But I do feel that at the right doses with the right combination, there may be a benefit for people for pain and for sleep. And as you mentioned also, maybe also for anxiety. I do believe that's another area that it could potentially be helpful. But I think we still have so many unanswered questions. Which type of cannabis, which formulation, which dose, that it's very hard for us as doctors to give the right advice to patients and families. And this is, I think, where all the sort of confusion arises. So I do believe there is some role, but with those caveats attached.
Right. Well, I'm hearing that, many doctors aren't equipped to answer the questions at this point. And
And that's absolutely correct. And I think this is where we're at now in terms of the field of people who are doing research in cannabis that is coming together to try and answer these questions for other physicians and for people who want to use cannabis. So the University of Toronto has brought together a whole range of researchers in cannabis, ranging from people who do work in the lab through to people who do clinical trials like myself, to people who do large epidemiological studies. So they collect data sort of across provinces and countries. And there is a large group now of people looking at cannabis research in general across the board. So this isn't just for Parkinson's, this is all medical conditions. So hopefully with this sort of push to get these answers out, we will actually get there. Hopefully with support from governments and funding agencies to enable researchers to do the research, I think we will start to get some of these answers for people.
Right. And have in that case, and on the topic of answers, where would you suggest people go to get evidence-based answers?
Well, as in one of the slides, there is some information that has been put out by Health Canada. There is a website link that is in this slide deck, which is maybe a little bit technical for some people, but it does give a very good overview of all the studies and evidence that has been published up until probably a year or so ago. So it's very up to date. That gives you a very good overview of evidence related to cannabis in general. And the problem again, though, is that in a lot of areas of Parkinson's, we don't have that evidence-based research that's been published. There are the small studies I've already mentioned, but this is really why we need to do more studies, because we really don't have those answers.
Okay. Well, I think we are pretty close to running out of time here, Dr. Fox. Is there anything else you want to add just to sort of guide our audience to where they can find more information that, put in layman's terms?
Sure. I would just really encourage people just to be very careful about cannabis products that they're buying or their relatives or friends tell them to try and use. Just be very cautious. In terms of evidence that may help you guide whether you're going to use it and what doses, some of the other websites that may be helpful, the Michael J. Fox Foundation, I believe, has some information about cannabis products, but overall there isn't a lot out there. I guess that's the bottom line.
Yeah.
That's the problem. And so this is hopefully where perhaps you've got a little bit, people have had some information from this webinar, but the challenge really is there's not a lot of good evidence to go to. I can perhaps put together perhaps a few more links for people. I'll maybe send that to whoever, and they can send that out, so that perhaps gives a little bit more information.
That would be great. Maybe we can attach it to the bottom of our,
Yes, I'll look into that.
to the recording email. Sure.
Yes, for sure. Yes.
That would be great. Well, I want to thank you, Dr. Fox. This has been really eye-opening, and I just want to remind people to go to the link at the top right of the chat box to take the survey today. And I want to say that sadly, that's all the time we have, and this is actually the last webinar of our 2019 series. So I want to say thank you again, Dr. Fox, for doing this for us and providing us with these wonderful, just wonderful resources, wonderful information and guidance. Parkinson Canada wants to thank everyone online as well for participating and supporting us in bringing you the conversations that resonate with the Canadian Parkinson community. For more information on medical cannabis or to access a recording of this webinar, please do visit our website at www.parkinson.ca. And if you have any other questions regarding today's session, please feel free to contact us by email at info@parkinson.ca. And you're welcome to call us toll-free at 1-800-565-3000. Again, Dr. Fox, we hope you have a wonderful day and thank you. And as we sign off, to the rest of you, have a fantastic afternoon.
Thank you very much.
Thank you.